female reproductive system has two egg producing and hormone producing organs called ovaries, one on either side of the uterus. And when the cancer begins in this organ, it's called ovarian cancer. It is called a silent killer because, in the initial stages, it may not give you any symptoms. So you'll not get to know about it. And whenever the symptoms occur, they are often confused with the general abdominal symptoms. So the patient doesn't reach a gynecologist or a gynecologist, and invariably the diagnosis gets delayed. Ladies suffering from ovarian cancer may complain of loss of appetite, pain in abdomen, bloating, nausea, vomiting. At times they complain of constipation, sometimes diarrhea. So all these symptoms, they confuse the patient also and at times the doctor also, because they are invariably confused with the normal general GI symptoms, the abdominal symptoms. So that is how and that is why the patient reaches the doctor, gynecologist, very late. So whenever you have these GI symptoms or abdominal symptoms, it's important to see a general physician, that's fine. But if you fall into a category of high risk or these symptoms are not getting better, then it's important to see a gynecologist also so as to rule out any ovarian cancer. Advancing age is by itself a risk factor. Though ovarian cancer can happen at any age, but as you grow older, the risk increases, more so after the age of menopause. The other risk factors are that if you have a personal history of cancer, say like breast cancer or a uterine cancer or a colorectal cancer, if you have a family history of ovarian cancer, that's a risk factor. If you have a genetic mutation like BRCA1 and BRCA2, that makes you a high-risk patient. In addition to this, obesity, smoking, and your personal reproductive history, say if you conceive at an older age, you deliver at an older age, that's again a risk factor. And if you don't breastfeed your child, that is again a risk factor. It's important to know your risk category, whether you have a family history of cancer or a personal history of cancer or BRCA mutation. So it's important to know that. And maintaining a healthy weight is important. So exercise and take good diet. Do not smoke. That's important. And if feasible, plan your pregnancy slightly earlier on and breastfeed your child. And if at all you are BRCA1 or 2 positive, then at times your doctor will recommend you removal of both the tubes and ovaries after a certain age. You can take birth control pills also to decrease your chances of getting cancer, but that should happen only after the consultation with your gynecologist.